Hi friends, I am Dr. Shraddha, Consultant Dermatologist, New Roots Hair Transplant Clinic, Nagpur. PRP or platelet-rich plasma therapy is nowadays recommended everywhere after hair transplant. But what exactly is PRP? What are the benefits of PRP? When should the PRP be started after hair transplant? How many number of sessions are needed after hair transplant? What are the benefits of PRP during hair transplant? Is it mandatory to take PRP after every hair transplant? Let us discuss all these queries in details in today's video. PRP is a concentrated plasma obtained after a centrifuge of a patient's freshly withdrawn blood, and it is a cocktail of a platelet, growth factor, cytokines and leukocyte. It has been observed to help in hair loss prevention as well as promoting wound and soft tissue healing. Why is PRP recommended after hair transplant? During hair transplant, the hair follicles are harvested from the donor areas and are implanted into the recipient areas. During this time, the hair follicle goes into resting phase as there is a breakdown of a blood supply. During this phase, the hair follicles require extra support by the growth factors. This nourishment of the hair follicles is provided by the platelet-rich plasma. There are minor surgical injuries in the scalp due to its slit and implantation. These all are recovered very faster than the usual time with the help of growth factors present in the PRP. Advantages of PRP after hair transplant. During harvesting of the hair follicles from the donor area of the scalp and its implantation into recipient area, hair roots have chances of getting damaged in many ways, such as dehydration if the donor hair roots are not sufficiently kept in hydrating liquid from its collection to its transplantation. Also, because of the lack of oxygenation due to withdrawal of a blood supply from its period from collection to transplant, and due to some temperature and acid bed changes in the follicular environment. Hair PRP after transplant promotes tissue repair and healing as well as helps the process of hair production with the help of growth factors by stimulating transition from resting phase to active phase as well as improve the hair growth and diameter. Many surgeons use PRP treatment during hair transplant procedure to store graft that improves the viability of the graft. Also, it is injected in the wound to promote faster wound healing. Overall, it minimizes scarring and promote maximum hair growth in the transplanted follicles. When should PRP be started? With PRP, the growth factors present in the platelets are provided to the scalp. Overall, it has a positive impact on the whole healing process. However, for the PRP treatment to be successful, it is extremely important to schedule it at the right time. The first session can be scheduled as early as 10 days post-transplant without any problem. Further sessions can be scheduled at 1 month, 3 months and 6 months post-transplant. Usually 4 sessions are enough for optimum results. What if anyone is unable to take PRP after hair transplant? It's not that he will not get results, but yes, he may lose the benefits of PRP which are helping in boosting its hair growth. Remember, PRP stands out as an innovative and advanced treatment. With this treatment, you can increase the success of your hair transplantation. Moreover, not only on the newly transplanted graft, but also the condition of your existing hair will be positively affected. It will strengthen your existing hair roots and your weak hair will become fuller and stronger. But never forget, the success of hair transplant not only depends on PRP but on the protocols that are followed during your hair transplant procedures, and also it largely depends on the adequate post-procedure care and medications. Thank you.